Hi, I'm Peter Pronovost, the Johns Hopkins Medicine Senior Vice President for Patient Safety and Quality and the Director of the Armstrong Institute. One of the most important ways you can keep yourself safe in caring for patients with Ebola is to make sure that you learn to put on and take off personal protective equipment in the most appropriate way. Now, the Centers for Disease Control has provided us detailed guidance for how to do that, but we needed training modules. So we partnered with the CDC to do that. We pulled together our infectious disease experts, human factors and systems engineers, psychologists, instructional designers, and technology experts to come together to produce this content. We've been here a week, working long hours to make modules for you. And now what you will see are 3 key modules. Number 1, how to put on or don personal protective equipment. Number 2, how to take off or doff personal protective equipment. And number 3, how the observer can work together to help ensure your safety using teamwork behaviors that were developed by the Agency for Healthcare Research and Quality. Now, we know these are anxiety-filled times. Believe me, I'm a critical care physician. I'm right with you. But we also know that with proper training and when we ensure your competency in putting on and taking off this equipment, we could safely care for these patients. So we hope you enjoy the training, and from our colleagues at the Centers for Disease Control and our colleagues at Johns Hopkins Medicine, we thank you for all you do for patients.
This training module discusses the roles and responsibilities of trained donning and doffing observers, called trained observers. A trained observer is a clinician, most likely an infection prevention professional, nurse, or physician, whose sole responsibility is to guide healthcare providers as they don and doff personal protective equipment, or PPE. When acting as a trained observer, you will not be delivering care directly to patients. Instead, you will focus on ensuring the safety of healthcare providers and, in some circumstances, their doffing assistants. You may directly assist your care delivery colleagues as they don their personal protective equipment. You will need to walk through the care processes and equipment usage patterns of your institution to understand if and when a doffing assistant is required. If your institution determines that there are circumstances where you, as the observer, will also offer doffing assistance, you should strictly minimize direct physical contact. When you work with a healthcare provider and doffing assistant, you will not assist at all. You are a proactive risk monitor, protector, and guide who calmly leads healthcare providers through the routine aspects of donning and doffing personal protective equipment. Remember, an effective observer is vigilant in spotting breaches, is proactive in identifying upcoming risks, uses the checklist but focuses on the big picture, is informative, supportive, and well-paced in issuing instructions or advice. Always washes immediately after providing assistance. The broader goal is to minimize the amount of direct contact assistance you provide. If you do provide assistance in doffing, remember always to disinfect your gloves. This hand hygiene step must be followed every time you touch possibly contaminated equipment. Hand hygiene is time-consuming, but is critical for safety and a good method of pacing the doffing process. As an observer, you will ensure the safety of the healthcare provider by helping them to manage the complexity of the critical donning and doffing tasks. You will also provide psychological support during an inherently stressful experience. Observers are responsible for monitoring to maximize safety by ensuring compliance with personal protective equipment protocols, guiding, correcting, and assisting colleagues as they work through the process of donning and doffing, protecting yourself through proper personal protective equipment use during doffing, promoting mindful and steady adherence to protocols, anticipating and planning for risks. To achieve this, you must be a leader, a protector, and a guide who calmly coaches team members through the routine aspects of donning and doffing. As an observer, you will do much more than watch and record. You will be an active participant in protecting the healthcare worker. To do so, you need to customize your participation according to your facility's resources, equipment, and physical layout. You need to understand your local process. For example, healthcare providers will require more intensive assistance doffing certain types of personal protective equipment. How will you balance your role as an observer and leader with the need for physical contact? Will you require a doffing assistant? You will also actively lead and support your colleagues' actions. Only use the checklist as a guide. It is a memory aid, not a tick box. Use it to direct action and sensitize yourself and your team members to risks and adhere to safe practices. As a trained observer, you will be a team leader and responsible for maintaining accurate, complete, and up-to-date situational awareness. To do this, you will need to keep the big picture in mind, manage details, and help healthcare providers identify and avoid any potential protocol breaches. First, keep the big picture in mind. This includes understanding and managing the entire donning and doffing processes, where the healthcare worker currently is in the process, what your team members need, and any possible safety risks that have or could arise in a situation. Don't hesitate to give the team members an update on the big picture. It is critical to ensure everyone is on the same page. Second, manage details. This includes the effective completion of each step in the process. Monitoring adherence to protocols is central to the observer role, but be an active participant and use the checklist as a tool. Third, help clinicians identify and avoid potential protocol breaches by understanding the situation, thinking ahead, being sensitive to risks, and proactively communicating with your team members. You should remain vigilant about 4 factors while leading the donning or doffing process: the situation, team members, environment, and progress towards your goal. Be aware of the situation, including preparing needed equipment and ensuring the work area is properly configured. Always ask, do we have needed supplies and personal protective equipment in the correct sizes? Is the equipment functioning properly? Do we have waste disposal containers available? Are they full? Be aware of your team member status and their needs in order to support them. You should ask, are they fatigued? Proactively warn them during critical steps where fatigue may cause error. For example, when taking off a hood, warn them not to touch their face or wipe their brow. Are they overly anxious? In a calming tone, refocus them on the task at hand. Reassure them they will get through this. When beginning doffing, will you need a doffing assistant? Think through your local process and equipment. If you will need an assistant during doffing, make sure you have identified that person and that they will be available in the proper personal protective equipment before beginning the doffing process. Be aware of the environment and any risks it may pose. Ask, is there contamination of any areas, surfaces, or equipment? Are donning and doffing areas clearly designated? Are there any hazards in the environment? Be aware of progress towards your goal. You will be coaching the healthcare worker through donning and doffing. You guide the process and you set the pace. Letting your healthcare worker know how far they are in the process can be calming and support a steady and measured pace. Where are we in the process and what comes next? Pacing. Are we moving too fast? Do we need to slow down? The observer is much like a team leader or coach. It is your job to set the stage for safe completion of the donning and doffing processes. You will lead the process. This includes conducting briefings to establish role clarity. Who will be responsible for assisting if it is required? It is your responsibility to ensure you have the right people available at the right time and that they are adequately protected with appropriate personal protective equipment. Additionally, you will need to anticipate challenges your healthcare worker may experience along the way. Is there new personal protective equipment in use? Have our processes changed recently? Are there any hazards in the environment that can be managed? This also includes asserting your leadership to manage distractions and guide the clinician through the process. You will facilitate effective communication. As the support system for your healthcare worker, you can employ several tactics to ensure communication is clear, accurate, and timely. Establish red flag words to immediately stop action. Ensure understanding by having all directions verbally repeated by the clinician. Red flag words or stop the line phrases are verbal shorthand for important information or protocol steps, phrases that will be quickly understood. Red flag words improve the efficiency of communication and reduce the amount of effort and time you spend getting across critical information. In healthcare, CUS words are commonly used. I'm concerned. I'm uncomfortable. This is a safety issue. These are easy phrases that require everyone to stop and pay attention. It is up to you to define and reinforce the red flag words. Use words that have a consistent meaning in your organization. You should have red flag words defined for a breach in protocol requiring a full stop but no immediate hazard, a breach in protocol, and immediate hazard. Closed-loop communication helps ensure information is received and interpreted as intended. Here, messages that are sent are acknowledged and verified. Closed-loop communication should be verbal and explicit instructions that are repeated by the healthcare provider. Repeating instructions is critical in this situation. Your healthcare provider will likely be fatigued and stressed, known contributors to communication slips and lapses. Additionally, some of the personal protective equipment can degrade hearing. To address these challenges, use closed-loop communication for each instruction given. Closed-loop communication should be verbal and explicit. It should be used for each step of the protocol at both the beginning and ending of each step. Specifically, you should verbalize the next step of the process. The healthcare worker should repeat this back to you, and subsequently, you should verbalize when that step has been completed successfully. This pattern of communication not only ensures good information exchange, it helps to control and slow the pace of the process. While your primary role is a leader and coach, your healthcare provider may need physical assistance at points during the donning and doffing processes. During donning, you may assist at any point, as this is performed in a clean area with clean personal protective equipment. During doffing, you should remember 5 key principles. Minimize physical contact. Plan for when you will need a doffing assistant. Anticipate where you may need to assist. Protect yourself when you do assist. Once you assist, you are now contaminated. Discuss these points in your pre-briefing, where you review the process and clarify roles, and determine who will be stepping in at what points of the process. For example, in the doffing process, you may need to help the healthcare worker to remove respirator, gown, or jumpsuit. The points requiring assistance should be decided during the pre-briefing and process walkthrough, and a plan established at that point. The trained observer should not enter the room of a patient with Ebola, but will be in the personal protective equipment doffing area to observe and assist with removal of specific components of personal protective equipment, as outlined below. The observer should not participate in any Ebola patient care activities while conducting observations. The following personal protective equipment are recommended for trained observers: single-use, disposable, fluid-resistant, or impermeable gown that extends to at least mid-calf or coverall without integrated hood. Single-use, disposable, fluid resistance, or impermeable gown that extends to at least mid-calf or coverall without integrated hood. Single-use, disposable, full face shield. Single-use, disposable, nitrile examination gloves with extended cuffs. 2 pairs of gloves should be worn. At a minimum, outer gloves should have extended cuffs. Single-use, disposable, fluid-resistant, or impermeable shoe covers. Shoe covers should allow for ease of movement and not present a slip hazard to the worker. Trained observers should don and doff selected personal protective equipment according to the same procedures outlined for the healthcare worker. If the trained observer assists with personal protective equipment doffing, then the trained observer should disinfect outer gloved hands with an EPA-registered disinfectant wipe or alcohol-based hand rub immediately after contact with healthcare workers' personal protective equipment. The trained observer's role in the donning process has 3 major components. 1. Guide the healthcare provider through the donning process using the checklist. 2. Assist the healthcare provider in donning their personal protective equipment as necessary. 3. Continually scan your colleagues' personal protective equipment and the environment for possible contamination risks during donning. The checklist is a memory aid that structures the donning process. Its details are important, but they are not your only focus. The big picture here is keeping your colleague and yourself safe by identifying and avoiding contamination risks. All instructions from the checklist need to be verbally confirmed, closing the communications loop before they are acted on. Assuring successful completion of each donning step is one of your major roles. Remember to use verbal and explicit closed-loop communication for each step in the process. Ideally, as the observer, you tell the healthcare provider what step to perform. They verbalize back the task to ensure they understood, and you, as the observer, verbalize completion. Completion means a thorough check that every part of the healthcare provider's personal protective equipment is in place, intact, fits properly, allows freedom of motion so your colleague can do their work, is positioned to ensure all skin and hair is covered. Completion also means a thorough check to ensure no part of the personal protective equipment is ripped, torn. As an observer, you are guiding and protecting your colleagues. The foundation of your role is communication. The first step here is to agree on a system of engagement so that you and your healthcare provider colleague can signal one another that the donning and doffing process needs to begin. Will you use call bells, or hand signs, or verbal signals? Will you, as the observer, always be in a certain location or available on a certain pager or phone? The donning process begins when you and the healthcare provider engage one another and verbally review the protocol. This timeout or pre-briefing will involve confirming all necessary supplies are available, conveniently located, correctly sized, and in good working order, including no rips or tears. Running through the order of activities on the checklist. Setting expectations about the timeline and a slow, steady pace for completing the donning process. Establishing a common understanding of what you will do if something unexpected happens. Acting as a guide and protector means that you are proactive about identifying breaches of protocol and possible points of contamination. As examples, when you and your colleague begin the donning process, you may notice that they are still wearing jewelry or ID badges. Draw items like cell phones, jewelry, and ID badges to your colleague's attention well before they don any personal protective equipment. A good time may be when they first change into their fresh surgical scrubs. Other examples of proactive risk monitoring during doffing might include identifying issues with equipment.
I'm looking at your gloves. Do they seem to fit? They look a little big. Let's get you a different size.
Identifying placement and fit issues with personal protective equipment.
Now we're going to verify that the PPE was placed properly. We're going to make sure that all your skin is covered.
Controlling the pace of the donning process.
We're going to do this safely. We're going to do everything slowly and methodically. I'm here to help you if you have any kind of questions.
These are only some examples. Your role is to protect not just by reading from the checklist, but by proactively monitoring for contamination risks. The trained observer's role in the doffing process has three major components. 1. Guide the healthcare provider, and in some cases, the doffing assistant, through the doffing process using the checklist. 2. Ensure doffing proceeds at a slow, deliberate pace. 3. Continually scan your colleague's personal protective equipment and the environment for possible contamination risks during doffing. A major part of your role as an observer is to ensure safety by proceeding at a measured pace. Always engage in confirmatory closed-loop communications with the healthcare providers and doffing assistants you are guiding. You should assure successful completion of each doffing step, remembering that completion means a removed item is intact and has not touched clean areas, has been disposed of properly in the available waste container, and has not contaminated any staff members. The doffing process begins when you acknowledge your colleague's need to exit the patient care space. Before you approve their exit from the patient space, you must ensure you are wearing appropriate personal protective equipment. If you are not already wearing personal protective equipment, follow the protocols in place at your institution for donning observer-level protection to ensure your safety. As the observer, it is part of your role to maintain awareness of the situation and anticipate needs. Once you are wearing personal protective equipment, you should inspect the doffing area to ensure that an appropriately maintained and not overfilled medical infectious waste container is available. All other equipment necessary for doffing should also be available and in good working order. Also, at this time, determine if you will need a doffing assistant to help safely remove personal protective equipment. You will need one if the healthcare worker is using a PAPR or a coverall. Once in the doffing area, remind the healthcare provider or the healthcare provider and doffing assistant to wait for your instructions before beginning the doffing protocol.
I'm here to help you through the doffing process. You'll hear me give you directions that aren't part of standard process, but they're designed to keep you safe.
It is important to remind the healthcare provider not to touch their face during the process.
Remember, go slowly and do not touch your face.
Appropriate communications will help you keep the healthcare provider and any doffing assistant safe. Take the time to go through the order and the activities on the checklist. Set expectations for a slow and steady pace for safely completing the doffing process. Prompted by the checklist, provide step-by-step instructions to the healthcare provider. Use closed-loop communication throughout the process. Each step should be acknowledged by the healthcare provider. the action taken, and then re-acknowledged by the observer as completed. Only then should you move on to the next step. Be familiar with the checklist, but remember, your focus is on the bigger picture. In cases where you will be assisting a colleague wearing a PAPR or an N95 respirator combined with a coverall, a third person will be needed. It is your role, as the observer, to ensure this person, called a doffing assistant, is available and wearing appropriate personal protective equipment. Be sure the doffing assistant is trained on the protocols. Remaining outside the doffing area, you will observe and guide as the doffing assistant inspects the healthcare provider for any signs of contamination. Any areas that are identified as contaminated should be disinfected using an EPA-approved disinfectant wipe. Remember, for safety, the doffing assistant is to provide a minimum of direct assistance to the healthcare provider. If they do assist the healthcare provider directly, it is your job to ensure they immediately perform hand hygiene. In cases where you will be assisting a colleague wearing an N95 respirator combined with a gown, your role, as the observer, is to guide their doffing, minimally assisting them if absolutely necessary. Unless assistance is necessary, you will remain outside the doffing area, guiding and pacing without coming into contact with your colleague. If you do provide assistance, you must immediately perform hand hygiene. Your role as an observer goes beyond reading the checklist. You should proactively sensitize the healthcare provider to risks at different steps of the process. For example, when a healthcare provider removes their protective headgear, they may be likely to inadvertently wipe their brow or push their hair back. When providing directions for these steps, you can offer supportive comments and reminders to be careful not to make those slips.